Hi, I'm Brittany. I'm one of the LVAD coordinators here at Riverside Hospital, and today I'm going to be showing you how to do the LVAD weekly dressing. The first thing that you're going to need is a patient, and then you're going to need to make sure you gather your supplies. Remember, this video is for nurses as well as caregivers, so if you're a nurse, make sure you use your proper hand hygiene when entering the room. Introduce yourself to the patient if you don't know them already, and explain to them what you're going to be doing. All right, the supplies that you'll need for this are a clean bedside table, a weekly dressing kit, gloves, some type of cleaning wipe. If you're at home, Lysol wipes are fine. If you're in the hospital, either purple wipes or bleach wipes. Just be mindful not to get the bleach wipes on any of your clothing. And mask. Anyone in the room needs to wear a mask, including the patient. You also want to make sure that your room doesn't have any fans on. You don't have any maybe small children or animals that could come and contaminate your sterile field once you get started. Okay, now we're ready to get started. I'm going to apply my mask and I'm going to clean off my bedside table. Okay, so I use my bleach wipes and I wipe down my sterile table and it's nice and clean. So I'm gonna start. First step is just like with our daily dressings, we're going to wash our hands for 2 minutes using a Hibiclin solution. For this video's purpose, I won't actually show you my hand washing, but know that I'm going to wash my hands for 2 minutes with a Hibiclin solution, okay? Next, I'm gonna grab my dressing kit and take it over to my table. Also, one thing that's very helpful is there are actually a weekly Driveline management system instructions in here. So if you don't have this video readily available, you can find the instructions in here. I'm going to pull the white tab to open your dressing. You take these instructions and sit them to the side. I like to use my patient's legs. And then you're going to remove your kit. Remember, everything on the inside of this kit is considered sterile, so you only want to touch this blue shiny material. We're going to open here. As you open, you'll see that you find your first pair of gloves. There's also a hand sanitizer wipe and extra gloves in case you've forgotten those. Your patient should already have that, so we're going to apply these gloves to remove the dressing. So find the cuff. Without touching the exterior of the gloves and apply them. My skin should only come into contact with the inside of the gloves. Once we have those on, we're safe to take the dressing that's existing on the patient off. The patient should have an anchor in place. We're going to unhook that so we have a little bit more flexibility. Then we're going to remove the dressing. Right, and then this should just kind of peel off. Make sure protecting the skin always underneath. Okay. You can just wad that up in your hand. And then we're going to remove the bio patch. There's a split in it. You just kind of pull it back and exposing your exit site. Take that trash, wrap it up in your hands, and remove those gloves. At this point, we're going to do another quick hand wash. If you're a nurse, you're going to step to the sink and wash your hands really quickly with the Hibiclin solution. If you're at home, it's okay to use a hand sanitizer that you may have in the room or step and wash your hands, whichever you prefer. Now that we've completed our hand wash, we're going to finish opening up our kit. You can remove these extra masks. I would hold on to these. It's always nice to have extras in stock. Then, being mindful not to touch the inside of the kits. It folds in 3. As you can see, our sterile gloves are kind of in the middle, so we're going to take, without touching any of this white in here, we're going to remove these sterile gloves and just kind of set these to the side with the Purell wipe. Then we're going to open our kits completely. Inside this, you'll have 2 Hibiclin swabs, some extra gauze, a bio patch, and then the actual dressing. So, without getting inside of your sterile kit, we're going to apply our sterile gloves. If there's any questions on how to do that, please refer to the written instructions that we provide. Okay, now we can move on to working in our kit. So you're going to cleanse the exit site with these 2 swabs. Then you're going to apply the bio patch and the dressing. The dressing has a window, so this side is up. Once you have it in place, you can peel these 2 pieces that remove the adhesive and apply to the skin. This kit also includes the Foley anchor. All right. Okay, to do the dressing, the first thing you do with the swabs is you're going to crack the ChloraPrep. You will hear an audible crack, and just turn it upside down and make sure that the sponge is getting filled with liquid. You can kind of see it starting to soap up. Then apply it directly to your exit site to get that moisture. Then slowly begin to twist, making sure you get up under that exit site, and then hop over and continue the cleaning with a continuous circular motion, working your way outward. Remember, we never want to scrub or go backwards or go back into it. Once you're done with that swab, we just toss that into our trash, and then we do the process again. Make sure to let that completely dry before our next step. While you're waiting for that to dry, it's okay to open your bio patch. Word to the wise, always open this over your sterile field. These things have a tendency to want to jump out. I always open facing downward and drop it into my sterile field. The bio patch opens up like this, kind of like a little Pac-Man. You always want to apply it with the writing facing upward. So this is what you should see through that window of the dressing. Once the patient's skin is completely dry, it might have a little bit of a shiny film due to the consistency of the ChloraPrep swab. Without moving the driveline much, raise it and bring the patch up tight around the driveline. Once that's in place, you're going to take your dressing. I like to take this first piece off so that I can see through my window where I'm going to go. This end is always facing where the driveline is, because it's perforated to let the driveline come through. All right, then you're going to take that and line it to where you have a nice visual of that bio patch. Once you have that part in place, you're going to pull this off and line your Driveline up. We then apply what we call the pants to the dressing. You can see it has a slit in it for the Driveline. It's going to come up and under, and it actually lays on top of that first dressing piece to really give a nice occlusive area to where that Driveline is. At this time, you want to assess your anchor. If your anchor is bubbled at all or not adhering to the skin, you always want to take it off or remove it, or if it's soiled. If it's intact, we can leave it on for up to 3 days. It's really just up to the patient. My anchor is pretty well adhered, so I'm going to leave it in place. I'm going to line up my Driveline with it. Find the tabs and pull through until all of the rubber pieces lock into place. You can see here. All right. And that completes our VAD weekly dressing. Thank you.